Hi, you should watch this video if you are considering gynecomastia surgery with Dr. Craig Fielding in Toronto, Canada.
Hello and welcome to So Have Ma'am Who's. My name is Chris, and today we're going to talk about gynecomastia surgery cost, my consult with Dr. Craig Fielding in Toronto, Canada. I went to go see Dr. Fielding in Toronto to have a consult regarding my gynecomastia. In this video, I will go through my impression of him and his office, go through my talk with Dr. Fielding, go through my specific situation regarding gynecomastia, go through Dr. Fielding's plan for me, go through the cost of surgery with Dr. Fielding, and finally go through my overall impressions of the visit and who Dr. Fielding is a good doctor for. When I was ready to book my appointment with Dr. Fielding, I gave him a call and spoke with his staff. They asked me the regular questions, make sure I had the proper documents such as a health card, and I booked an appointment. With at least 2,000 gynecomastia-specific operations under his belt, Dr. Craig Fielding is a Toronto-based Royal College certified plastic surgeon specializing in all of the most rewarding and beneficial procedures in cosmetic and reconstructive surgery, including breast augmentation, body contouring, and facial plastic surgery. This is a quote from his website. Since completing medical school at the University of Toronto in 1981, Dr. Fielding completed his plastic surgery specialty education in the Toronto program in 1986, followed by 2 years of additional training in the USA and Australia. He's been on staff at the St. Joseph's Health Centre since 1988 and has been involved in postgraduate education since then. He's the Chief of Plastic Surgery at the St. Joseph's Health Centre. His area of interest is in education for the last 10 years, has been in the field of medical ethics, where he is associated with the Joint Center of Bioethics and coordinates the teaching of this aspect of plastic surgery to the residents at the University of Toronto training program. He performs his surgical procedures in the operating room and minor surgery suite at St. Joseph's Health Centre and injections in his office. Consultations are either in his office or occasionally at the hospital. Dr. Fielding is a member of the Canadian Society of Plastic Surgeons as well as the Canadian Society of Aesthetic Plastic Surgeons, the Royal College of Physicians and Surgeons of Canada, and the College of Physicians and Surgeons of Ontario, for which he does consulting work. I chose Dr. Fielding because he was the most qualified gynecomastia plastic surgeon close to where I lived. I looked online at Real Self as well as Reddit and gynecomastia.org, and he had an overall good feedback from his patients that had worked with him. Dr. Fielding's office is located in Toronto, Ontario at 2425 Bloor Street, Unit 401. Located in the Bloor West Village, it is conveniently located close to public transit in a regular-looking medical building. The office itself is clean and professional looking. The staff there are professional, efficient, and friendly. When I arrived, the wait time to see Dr. Fielding was minimal. I was greeted by Dr. Fielding and brought into the consult room. There, Dr. Fielding briefly exchanged pleasantries and he proceeded to ask me a number of questions related to my health. For example, my age, my height, my weight, if there was recent weight loss, and if so, what was your heaviest? What is your current weight? Do you smoke? Any allergies to any medications? Questions like that. After I answered his questions, Dr. Fielding asked me to take off my shirt so he could see my gynecomastia. He gently pinched around the area a little and also pulled out some measuring instruments and proceeded to measure around my nipple area. After, he wrote a few notes down and gave me his assessment of the situation regarding my gynecomastia. He confirmed that it was indeed gynecomastia and not pseudo-gynecomastia. There is definitely gland tissue as well as fat tissue that is stimulated by hormones and not by diet. He spent a little time trying to assess my level of expectation regarding the surgery. He said that his goal was to have me comfortable with myself and my chest to the point where I didn't have to think about it as much. He mentioned a spectrum of satisfaction and wanted to make sure that my expectations about the surgery were not unrealistic. Personally, I've had these things flopping around for too long, and anything other than that would have been an improvement in my eyes. I'm not expecting to look like an 18-year-old bodybuilder. This is the TLDR. Be realistic about your expectations about surgery. Do not expect perfection. Also, accept the possibility that something could go wrong. It is surgery after all. He then proceeded to tell me about the risks involved. Due to my Asian heritage, my body is more prone to heavy scarring. that is a possibility, but it can be managed with massage and good post-operation skincare. There's also a 1 in 100 chance of a hematoma. A hematoma is basically blood pooling around the area where the excision has been taken out. Dr. Fielding said that a hematoma usually presents within the first 24 to 48 hours post-operation and can be managed by close observation and doctor care. In terms of my own case, it turns out my man boobs have started sagging due to age. My nipples turned out to be 2 inches lower than where they should be. Dr. Fielding proposed liposuction and excision of the gland. Through a procedure of scarring the upper pectoral area under the skin, Dr. Fielding hopes to have the nipples move back higher to where they should proportionally be. I was told that due to my situation, I would need to wear a compression garment for 6 weeks post-operation, whereas the usual is 3. Dr. Fielding stated that on average his patients report a 3 out of 10 on the pain scale post-operation. He said if you follow the post-operation instructions closely, then you have the best chance of recovery. Go figure. So yeah, follow your instructions closely and accurately. Dr. Fielding said I could begin lifting again after 3 weeks as long as I wear the compression vest at the time that I'm lifting. Afterwards, he asked me if I had any questions, and I did. I asked him what's the best thing I can do to prepare for surgery. He said not much, but if pressed, he mentioned I could lose some fat prior to surgery to obtain a slightly more optimal result. He mentioned about 5 pounds, which I did. I asked Dr. Fielding about his revision policy. If it has something to do with me and my negligence in not following post-operation procedures, then it is not covered by him. However, if it is something that he feels was from his work, he stands by his work and will do the revisions. And the cost is done on a case-by-case basis and determined then. He assured me that the pricing would be fair if a revision was required. I went outside and Leslie proceeded to quote me pricing for the operation with 2 options. Option number 1, excision and liposuction of gynecomastia glands, equaling $3,514 after taxes and hospital fees. Or option number 2, excision and liposuction of gynecomastia plus midsection and flanks liposuction for $5,712, which I declined to do. I made arrangements for another pre-operation appointment, which occurred 3 weeks later. At that appointment, I was made to fill out some paperwork and I paid. I was given instructions: nothing to eat or drink prior to midnight before surgery, no driving myself to the hospital, I would need a companion or a cab ride home, and I was to arrive at the 2nd floor surgical daycare at St. Joseph's Health Center on 30 the Queensway on the day of my surgery. Call the office a couple days beforehand to know what time to show up. And here are my overall impressions of the consult. Dr. Fielding was friendly, professional, and I never felt rushed or embarrassed. He took the time to thoroughly explain to me my situation and also took the time to answer my questions. He never seemed annoyed or impatient, contrary to some feedback I had heard online. He was also straightforward and direct, but not in a rude way. I felt that he wanted to give me an accurate assessment of the situation without fluff or exaggeration. You should see Dr. Fielding if you have done your research and are ready to have gynecomastia surgery done. I think that if you are sensitive or not quite sure whether or not you want to have surgery, it probably would not be the best time to see him. And there you have it. That is my consult with Dr. Fielding in Toronto, Canada. I hope this helps. Please consider liking and subscribing if you found this of value. My name is Chris. This channel is So I Have Man Boobs, and I hope to see you again real soon. Bye for now.
My goal with this video series is to help men who've just discovered that they have gynecomastia. I want to educate them with information and also help them ask better questions. I also want to take the stigma away from gynecomastia for men so that we can actually have a good discussion around this condition. If that is something that you are into, please consider liking, subscribing, commenting, and hitting the bell for notifications. Thanks so much. Thank you for watching this video.